You've seen the images, maybe you've driven past, maybe you've watched the news clips, and maybe just for a moment a thought crossed your mind. Why don't they just stop? Don't be too quick to judge, because what you are looking at on Kensington Avenue is not a moral failure. It is not weakness. It is not a choice that any human being would freely make. What you are looking at is a medical emergency unfolding in public, in real time in the city that gave the world the Declaration of Independence. The people on that street are not lost because they gave up. They are lost because every door out requires a key they cannot hold. Welcome to Homeless in America. Philadelphia is a city that carries extraordinary weight. It is where the Declaration of Independence was signed, where the Liberty Bell still stands, where, 250 years ago, a group of men sat down and declared that all people are created equal, that every human being possesses the right to life, liberty, and the pursuit of happiness. Those words were written less than 3 miles from Kensington Avenue. Today, that avenue, roughly 1.5 square miles in Philadelphia's northeast, has become the most visible symbol of the American opioid crisis. Thousands of people cycle through its streets each year, not because they were born here and not because they chose this, but because the systems that were supposed to catch them, the healthcare system, the housing system, the social safety net, failed, one by one, until the street was the only thing left. In this documentary, we are going to walk through what is actually happening in Kensington. Not the headlines, not the shock clips, the human reality, who these people are, how they got here, and why leaving is far harder than anyone standing outside that street will ever understand. If these stories move you, if you believe that every person you will meet in this film deserves to be seen, subscribe now and stay with us until the very end. Part 1. Kensington context and the people being left behind. To understand Kensington, you have to understand Philadelphia first. This is a working-class city. A city of neighborhoods, each with its own texture, its own pride, its own memory of who lived here and what they built. Kensington itself was once the heart of Philadelphia's textile and manufacturing industry. The mills along those streets employed generations of families. People built lives here. The mills are gone now. The factories that followed them are gone too. What replaced them economically never came close. On January 22, 2025, Philadelphia's official point-in-time count recorded 5,516 people experiencing homelessness on a single night. That is a crowd larger than most college graduations, spread across shelters, doorways, transit concourses, and open ground. But 5,516 is the waterline. In a single fiscal year, 15,000 unique individuals cycle through Philadelphia's homeless system, nearly 3 times what any single count can show. And within that city, one neighborhood holds more than 1/3 of every unsheltered person. Not a large neighborhood, roughly the size of a few city blocks stitched together. Kensington. 337 people were counted sleeping rough in Kensington alone in 2024, a 23% jump in a single year, a 12% average increase every year since 2016. The numbers don't lie, but they don't tell the whole story either, because behind each number is a person who woke up that morning with a name, with a history, with a family somewhere, maybe a family that does not know where they are. A person who once lived inside, who once sat at a table, who once planned a future that did not look like this. The first thing you notice when you walk through Kensington with an outreach worker is not the tents. It's the eyes, the way people watch you approach, calculating, is this safe? Is this someone who will take something or give something? That watchfulness is not aggression, it is intelligence. It is what survival looks like when every day requires it. How did so many people end up here, and why does the number keep climbing? Part 2. The substance crisis, what is actually happening in Kensington. To understand what is happening on Kensington Avenue, we have to look at this from a medical perspective. not a moral one. Substance use disorder is classified by every major medical institution, the American Medical Association, the CDC, the World Health Organization, as a chronic brain disease, not a character flaw, not a choice that a person makes with a clear mind and full options. A disease, one that alters brain chemistry at a neurological level. In Kensington, that disease has been supercharged by something most people outside of public health circles do not yet fully understand. Fentanyl is now detected in 98% of street opioid samples collected in this neighborhood. 98%. That is not an estimate. That is laboratory analysis. What it means on the ground: no one buying street drugs in Kensington can choose to avoid fentanyl. The choice has been removed from the equation entirely. They are not choosing fentanyl. They are being given no alternative. And now, there is a second layer. Xylazine, a veterinary sedative, has been mixed into the supply since 2021. It causes wounds, not minor wounds, deep, necrotic skin ulcers that can reach bone if untreated. Wounds that antibiotics cannot always reach because xylazine restricts blood flow. But xylazine is now being replaced by something even newer: medetomidine, a different animal sedative. And withdrawal from medetomidine does not look like opioid withdrawal, it looks like a seizure. In May 2025, the CDC reported that 91% of patients experiencing medetomidine withdrawal required ICU admission. 91% ICU-level care on a street with no hospital. This is the medical emergency that is happening right now, in real time. In Kensington, it is largely unreported in mainstream media, but every outreach worker, every harm reduction nurse, every physician who has walked that street in the past year will tell you, we have never seen a drug supply this dangerous, this unstable, this impossible to detox from safely in a non-medical setting. They are not choosing to be sick. They are caught in a pharmaceutical crisis that no individual decision can resolve. If you knew that the substance coursing through someone's system required ICU-level care to safely stop, would you still ask why they don't just quit? Part 3. Human Faces, Trapped Fates. No one is born with a dream of sleeping on Kensington Avenue. Every person on that street came from somewhere, had a name someone gave them with love, had a first day of school, a first job, a first home. The path from that life to this one was not a single leap, it was a series of closures. Doors that shut one after another until there were no more doors. Consider a man in his early 50s, 15 years on a factory line in Northeast Philadelphia, the kind of work that doesn't make headlines, but builds a city. The factory closes. No severance, no safety net. 2 years later, back surgery. The prescription that follows becomes a dependency before he understands what is happening. When the prescription ends, the withdrawal does not. The street has something that stops the pain, and the street asks far less of him than any clinic did. He is not on Kensington Avenue because he gave up. He is there because every institution that should have caught him, the employer, the healthcare system, the social safety net, released him at the exact moment he was most vulnerable. Or consider a young woman 23 years old. She aged out of Pennsylvania's foster care system at 18, placed in a transitional housing unit with a 90-day limit. The limit expired before any stable placement was found. She entered the street with no ID. It was lost inside the system. No rental history, no credit, no family to call. Invisible to every formal pathway, the community that formed on the street was the first community that did not have an expiration date on her. She is not a statistic. She is a product of a system that processed her and then discarded her the moment she stopped being a child. Or the home health aide, a single mother, couch surfing between 3 contacts after her landlord sold the building and rent in her neighborhood doubled overnight. She does not appear in PIT counts. She is the hidden face of homelessness. They are not a social problem. They are human beings trying not to collapse. If any one of these turning points had been caught by a doctor, a landlord, a caseworker, a safety net, would they be here at all? Part 4. A day in Kensington survival. Hour by hour. When the prism of statistics steps back, reality appears in every breath. 6 in the morning. Before the city sanitation crews arrive, because their arrival can mean the destruction of everything you own. Your tent, your documents, your medications, your only pair of dry socks. Everything you carry is your entire life, compressed into one bag. You wake before the sweep because experience has taught you what the alternative costs. You find a working public restroom. Most in Kensington are locked or require a purchase. You find one that isn't, or you don't. Noon. This is when the body makes its demands. Fentanyl withdrawal begins within hours of the last dose. Nausea, muscle cramping, sweating so severe it soaks through clothing in minutes. For those whose supply contains medetomidine, the risk now escalates. Withdrawal can move toward seizure territory without warning. The calculus of the midday is not how to get high. It is how to avoid becoming violently ill in public. Those are different things. They are worlds apart. Afternoon. Navigate the bureaucracy of survival. The shelter waitlist requires a daily check-in by phone or in person. Miss it, and you lose your place. If the wound care van is running today, Project Home's clinic on wheels, parked on Kensington Avenue, you go. The wound from a xylazine ulcer does not heal on its own. Left untreated, it reaches bone. Charge your phone at the library if you can get there. Lose the phone, lose the shelter queue. Their entire life in a frayed backpack, night falls, and with it, a vulnerability that has no parallel in housed life. No walls, no lock, no door. Every sound in the dark is a calculation. Is this safe? A volunteer who remembers your name, who hands you a clean pair of socks without looking away, restores something that the day has stripped from you. Not charity. Recognition, the acknowledgement that you are still a person. When 24 hours are consumed entirely by the act of surviving, how much space remains to imagine tomorrow? Part 5. Why they can't leave. The locked doors. A question many people ask genuinely, and not unkindly, is, why don't they just leave? It is worth answering that question with the same seriousness it deserves. The first door is the most immediate. Active substance use disorder disqualifies a person from most emergency shelters in Philadelphia. The shelters require sobriety or enrollment in active treatment, but detoxing from fentanyl combined with medetomidine now requires ICU-level medical supervision. The street cannot provide that. Treatment waitlists run weeks long, so the person who wants to stop cannot access the system that requires they stop first. The second door. Treatment programs require contact information, typically a phone number tied to a stable address. Without a stable address, people lose their place in queue every time they move, every time a sweep displaces them, every time a phone dies or is stolen. They re-enter the waitlist. They start over again. This is not a metaphor. It is the administrative reality of seeking help without a home. The third door. Income requires employment. Employment requires passing a drug screening. Drug screenings require documented sobriety. And income, employment, and sobriety all require a government-issued ID. Birth certificates, Social Security cards, the foundational documents of legal existence, are routinely destroyed during encampment sweeps. Belongings are discarded by sanitation crews. Without those documents, no employment, no benefits, no bank account, no lease. A person can become, in a legal sense, functionally invisible. The Homeless Advocacy Project's SOAR program exists specifically to restore those documents and begin SSI/SSDI enrollment. In 2025, they helped approximately 200 people against a system cycling 15,000 per year. This loop is not laziness. It is not a failure of will. It is a cage, and the door is on the outside. Every encampment sweep does not just displace bodies. It destroys the outreach relationships that took months to build. Every sweep resets the trust clock to zero. We need more bridges, not more orders to get over it. If every door you tried to open required something you could only get by already being through the door, where would you begin? Part 6. Signal the community that does not turn away. Amidst everything we have described, amidst the medical complexity, the systemic traps, the daily weight of survival, this city still has people who show up every morning. Prevention Point Philadelphia opens its doors at 2913 Kensington Avenue. This organization sits in the middle of the crisis, not outside it, not adjacent to it, but inside it. In 2025, their team distributed 113,571 doses of Narcan, a 13% increase from the year before. Each dose is a moment when someone did not die. They sheltered 377 people in their Beacon House facility, a 140% increase. They logged 2,494 drug treatment visits from 539 patients, and 1,378 people were trained through PPP's programs to reverse an overdose themselves. A meal at PPP's drop-in center is not just food, it is the first moment in a day when someone looks at you without fear, without judgment, without wanting something from you. It is recognition. It costs very little to provide. It changes something in a person that no statistic can measure. Project Home sends its wound care van directly into the neighborhood Monday through Friday, parked on Kensington Avenue, providing medical care to people who cannot travel to a clinic. A volunteer who remembers your name, a nurse who asks how you're sleeping. Small gestures, enormous weight, and the Homeless Advocacy Project, working quietly, case by case, helps people rebuild the documentation of their legal existence. A birth certificate recovered, a social security card reissued, an SSI application filed and approved. In 2025, they secured long-term income for approximately 200 people with a 90% application approval rate. 200 people who now have a number, a check, a first rung of the ladder, from a single conversation, to a support profile, to a shelter slot, to the beginning of a road home. Part 7. Hope and the Road Forward. Our journey through Kensington does not end here. It is only the beginning. There are real signals of progress, slow, hard-won, and incomplete, but real. PPP's permanent housing transitions are accelerating. 52 people moved from emergency shelter to stable housing in fiscal year 2025. Each one of those 52 represents a full human arc: a tent, a shelter bed, a caseworker, a key and a door. Philadelphia's harm reduction infrastructure is among the most sophisticated in the nation. The Narcan numbers 113,000 doses in a single year represent a city that has decided that the people on that street are worth keeping alive long enough to reach the next door. And within the research community, the medetomidine withdrawal crisis, only now surfacing publicly, is generating the kind of attention that, historically, precedes medical protocol change. The ICU admission data published by the CDC in May 2025 is already in the hands of emergency medicine physicians nationwide. This is how medical systems learn, slowly. But they learn. There are people in Kensington who have walked out, who have a door now and a bed and a morning that begins differently. Their stories are not as loud as the images from the avenue, but they exist. A city is not measured by its tallest buildings or its oldest bells. It is measured by the way it treats those in its lowest places. If you believe that the people we have met in this documentary deserve a real chance, not just a headline, subscribe to Homeless in America. Comment below and tell us, what do you believe is the single biggest barrier preventing someone from rebuilding their life after homelessness? Share this video. The people on Kensington Avenue cannot speak to the people who need to hear this story. You can. In this moment, we offer a quiet prayer for every person experiencing homelessness in Kensington and in every corner of Philadelphia. May you find safety in the days ahead. May gentle hands reach out to you with kindness. May the weight you carry begin to lighten. And may a warm, stable home